Begin by having the patient walk a safe distance parallel to a wall. At the end of the distance, have the patient perform a half turn and return to the starting position walking in tandem. If performed with no difficulties with one allowed misstep, the patient is given a score of 0. A score of 4 is given with marked staggering and intermittent support of the wall. A score of 6 is given if the patient is able to walk more than 10 meters, but only with strong support. The patient is asked to stand barefoot on a flat surface with their eyes open, and 3 trials are completed for each position. Position 1 is feet shoulder width apart. If this is done for greater than 10 seconds, the patient is given a 3. Next, the patient is asked to bring their feet together in a narrow base of support. If they can do this without sway or support for more than 10 seconds, they're given a score of 1. Lastly, the patient is asked to place their feet in tandem stance. If this is completed without sway or support for more than 10 seconds, the patient is given a score of 0. Patient is asked to sit on exam bed without support of their feet. Arms should be stretched out and eyes are open. A score of 0 is given if the position is held for greater than 10 seconds with no difficulty. Oh, guys, she's back.
Oh, come on, get out. We're trying to film here.
A score of 2 is given if there's constant swaying, but patient is able to sit for greater than 10 seconds without support. A score of 4 is if they are unable to sit for 10 seconds without support. Speech is also assessed during normal conversation. A score of 0 is given for normal speech. A score of 3 is given for occasional words that are difficult to understand. And then a score of 6 is given if speech is unintelligible. Instruct the patient to follow your movements with their index finger as fast and precisely as possible. Movement should be 30 cm every 2 seconds, and the average performance of the last 3 movements is rated. Patient receives a 1 if there is less than 5 cm of dysmetria, a 2 if there is less than 15 cm of dysmetria, and a 3 if there is greater than 15 cm of dysmetria. Patient receives a 4 if they are unable to perform. Patient is instructed to point repeatedly with their index finger from the therapist's finger to the patient's nose. Position your finger in front of the patient at 90% of the patient's reach. Patient's movement should be performed at a moderate speed, and the average performance of movements is rated, and each side is rated separately. Patient receives a 0 if there is no tremor. They receive a 1 if tremor is present with an amplitude less than 2 centimeters. Patient receives a 2 if tremor is present with an amplitude less than 5 centimeters. Patient receives a 3 if tremor is present with an amplitude greater than 5 centimeters. Patient receives a 4 if they are unable to perform 5 pointing movements. Instruct patient to perform 10 cycles of alternating palm up and palm down motions on the patient's thigh as fast and precisely as possible. Scores from 0 to 4 are given based on the clarity of the irregularity of movement. Patient is instructed to lift one leg and point heel to the opposite knee, sliding their heel along the shin to the ankle and then lay it back on the table. Patient receives a 4 if slide is normal. They receive a 1 if there's slight abnormality present but the heel to shin contact is maintained. Patient receives a 2 if clear abnormality is present and contact is lost upon 3 times in 3 cycles. Patient receives a 3 if severe abnormality is present and contact is lost 4 or more times in 3 cycles. And patient receives a 4 if they are unable to contact heel to shin in 3 attempts. With patient in sitting, instruct patient to sit up in a chair and remain as still as possible as the therapist provides resistance. Provide resistance to the patient's shoulders in random alternating directions, forcing patient to use their trunk to stabilize them without losing posture. For lifting, instruct patient to hold hands together on one side of their body while flexing neck and trunk to the same direction. Have patient lift arms together above head to the opposite side while extending neck and trunk. Perform reciprocal motion for chopping. Once patient is able to perform independent lifting and chopping patterns, provide resistance in the opposite direction at distal arms and head. This exercise can be performed on either side. Frankel's progressions begin in supine on a smooth surface with the patient's head raised so they can see their limbs moving in space. So bend one leg at the hip and knee, sliding your heel along the table. Return the foot to the starting position, keeping your foot on the table. Bend one leg at the hip and knee, sliding along the table, but return the foot to the starting position by sliding your leg out to the side and then back to the center. Next, bend one leg at the hip and knee with the heel raised from the bed. Straighten your hip and knee to return the foot to the starting position. Repeat the first task with the addition of randomized commands to stop and go from the therapist. Bend one leg at the hip and knee and place the heel on the opposite knee. Slide the heel to the shin, back up to the knee, and then return the foot to the starting position. Next, bend both hips and knees, keeping the ankles together and the heels on the bed. Lastly, bend one leg at the hip and knee in alternating identical motions with the opposite leg. To a metronome, alternate raising heel off the floor. Progress to alternating raising each foot onto pre-drawn feet which are placed on the floor in front of the patient. Alternate gliding feet over a pre-drawn cross on the floor placed in front of each foot. Cross forward and backward, left and right. Using a metronome, now rise from the chair. On beat 2, bend the trunk forward. At beat 3, rise by straightening the hips and knees. Reverse to sit down. Perform sidestepping to a counted cadence or metronome. On count 1, patient should shift weight to the left. On count 2, step with the right leg. On count 3, weight shift to the right leg. And on count 4, step with the left leg. Walk forward between parallel lines placed 14 inches apart, keeping both feet inside the respective lines. PT should emphasize correct placement of the feet. Walk forward, place each foot onto pre-drawn feet placed on the floor 2 inches from the center line. Begin with quarter steps, progressing to half steps and then full steps. Turn to a metronome. Count 1, raise the toe and rotate the foot outward. Count 2, raise the opposite heel and pivot the leg inward. Repeat on the opposite leg. Walk up and down stairs. Begin with non-reciprocal movement with the railing. Progress to reciprocal movement with the railing. Next, progress to non-reciprocal movement without a railing. Finish with reciprocal movement without a railing. Fine motor skills are trained by completing half-drawn circles, as well as drawing perpendicular lines through already drawn lines. A progression can be to challenge trunk stabilization with the use of a weighted vest. A progression from stance balance exercises is the 4-square step test. Patient begins by stepping into square 1 with both feet. The patient will then step with both feet into square 2, followed by 3 and 4, making sure to clear the canes completely. The patient will then repeat in the reverse order. Patient can be timed to show improvement. During stop and go ambulation, the patient is asked to walk at a comfortable speed and then stop and start based on the therapist's cues. The next progression is to blindfold the patient and remove any visual input. A final progression is to have the patient continue to walk at a safe speed, but implementing in head turns to decrease vestibular input. No chairs of the physical therapy department were harmed during the making of this film.